You are the Canadian Donation and Transplantation Research Program. You are CDTRP.
The CDTRP is a network of more than 400 clinicians, senior, mid, and early career researchers, trainees, patient, family, and donor partners, and 100 partner organizations. Our network has supported 275 collaborative research projects and has mobilized research into policy change, legislation, commercial products, and improved knowledge for patients, families, and donors. Every year, CDTRP supports between $30 to $40 million in grant applications, something around 60 to 70 individual applications. You are CDTRP. These achievements wouldn't be possible without your hard work.
CDTRP Research Services is a platform that supports principal investigators to develop high-quality research in donation and transplantation. We work hand-in-hand with CDTRP investigators to maximize the effectiveness of research teams through support with funding development, project management, patient, family, and donor partnership, knowledge mobilization, events, and trainee support. Across the 5 research themes, we help teams mobilize new knowledge to ensure patient, family, donors, healthcare systems, partners, and stakeholders equitably benefit from research results.
If you are a basic scientist and would like support with your knowledge mobilization plan, if you are a busy clinician scientist with limited time for research but would like to run a multi-site study, if you are an early career researcher and looking for collaborators to help with your grant applications, if you value patient, family, and donor engagement but are not sure how to find the right patient partners or what role they will have in your project, if you don't have full-time research staff but need support,
we are here to help. Our experienced management team can support you at every stage of your research in donation and transplantation.
Now you are probably thinking, how can I request CDTRP Research Services support? The answer is simple. Go to the CDTRP Research Services Platform website, fill out the form to request support, and we will get in touch with you to discuss your needs. That's it.
We.
No.
Noi.
Nos.
Emis.
Nosotros.
Menk.
Kiano. We. Kiano.
Our CDTRP, and we will drive research advances so that every wish to donate is fulfilled and transplantation becomes a lasting and sustainable cure.
You are CDTRP.
Email us today.
Welcome everyone to the 2024 Patient, Family, and Donor Research Forum. My name is Len Hodder. I've been a patient partner with the CDTRP since 2021, and I also volunteer each week at Toronto General Hospital and with the Transplant Ambassador Program. I'm a living liver and kidney donor after watching a movie at Christmas time in 2018 where a stranger donated a piece of his liver to a woman. who was in need, it struck me as the perfect opportunity to allow me to give back as well. And so I donated a piece of my liver in 2019, and 2 years later donated a kidney as well. So I live in Brampton, Ontario, where I'm self-employed as a project manager for our family business. And that's given me the freedom and the flexibility to get involved in all of these extracurricular activities that I love so much. So if I can pick on an example, volunteering at Toronto General in the physiotherapy department is just so inspiring to me. And over and over, I see patients who are dealing with lung disease. They're on oxygen and sometimes struggling for every breath. Doing exercises to often just maintain their current level of health. And then they disappear. They got the call. And a month or two later, they're back with a new set of lungs. They no longer struggle to breathe. And over the next few months, they regain their strength and they're able to return to their normal daily activities. And of course, the same kind of recovery and freedom is often true for every other type of transplant recipient. And that's what inspires me. That's why I'm here today. So, kudos to all those amazing people that turned research into medical reality. So I have the pleasure today of co-chairing this year's forum alongside my colleague, Dr. Ruth Sapir-Pichhadze, and the planning committee. And this is the second year we've done so. So we're so pleased that you've decided to spend some time with us this year. We have an exciting program set out for today and tomorrow. And we would also like to thank the CIHR, whose generous support enabled us to host many sessions this year, including this forum. Now, please join me in welcoming Dr. Ruth Sapir-Pichhadze.
Thank you so much, Len, for the introduction and welcome. And thank you, everyone, for joining us as we work together to strengthen patient engagement and ensure that our experiences help enhance research. With your permission, I'll start with a land acknowledgement. And given this event is organized by CDTRP, we will acknowledge that the CDTRP is hosted by the University of Alberta, which respectfully acknowledges that it is located on Treaty 6 territory, a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, Inuit, and many others, whose histories, languages, and cultures continue to influence our vibrant community. We also like to acknowledge all the lands of First Nations, Inuit, and Métis people. Since we are meeting virtually, please share the territory you are joining us from and use the chat box for this purpose. I'll continue with introducing myself. My name is, as Len mentioned, Ruth Sapir-Pichhadze. I'm a transplant nephrologist and a clinical epidemiologist based at McGill University Health Centre in Montreal. The overarching goal of my research program is to optimize the quantity and quality of lives of patients with kidney disease. More specifically, I'm looking to identify ways to optimize compatibility between donor and recipients, personalized monitoring of patients undergoing transplantation, and established individually tailored therapies. Over the years, recognizing that immune-suppressed patients are also vulnerable to experience complications from the therapies that are administered to prevent rejection, I've also took upon myself to pursue research projects focused on these complications in an effort to put forward personalized transplant care research program and address those. Pertinent to our discussion today is the sensitivity on the part of collaborators I've worked with, my team and myself, to the fact that as we pursue the research questions are outlined and inform personalized care, the patient's voice is in fact at the center of this effort. And as we pursue efforts to promote knowledge generation in this domain, it is important to incorporate the needs, the values, the preferences of patients, their family members, donors, as we proceed with pursuing our research endeavors. Through this recognition over the years, again, I've participated in initiatives like CanSolve CKD, Women in Transplantation, and of course, CDTRP, which brings us all together. So with this, let us proceed to focusing on the event today and tomorrow. So throughout those 2 days, we will focus on enhancing patient engagement in clinical trials, advancing our understanding on equity, diversity, and inclusion principles in health research, and explore together how we can apply these aspects in the fields of organ donation and transplantation. The full program is accessible on the CDTRP website. Please note that during the presentation, you should feel very free to ask questions and make comments as we go along. Please don't be shy. Your participation is imperative to the success of this event. And you can post your questions in the chat, send them anonymously through the CDTRP Q&A tool, or raise your virtual hand and make a live comment. This is also a friendly reminder to our speakers to do their best to respect their allocated time so that we make sure that we abide by the program timeline. For those who are new to CDTRP, it's also a nice opportunity to highlight a few points. CDTRP is a pan-Canadian research network that supports Canadian researchers. The research services offered by CDTRP aim to maximize the effectiveness of research in donation and transplantation. Collaborators with CDTRP investigators have the benefit of enhancing the various stages of their research, and CDTRP personnel can provide support on grant development, project management for patient, family, and donor partnership and engagement, as well as towards knowledge mobilization, a variety of events, support for trainees, importantly. And as a member of CDTRP, you may be able to leverage this expertise. So if you haven't done so yet and you're interested, please go to cdtrp.ca and register there, as well as access the research services and the platform to submit your request today. Last but not least, I'd like to introduce you to Amy Thatchell, who will moderate today's session. Amy is a recent master's graduate who completed her training under the supervision of Dr. Blythe Hansen at the University of British Columbia. She's been a CDTRP trainee for the past couple of years. Her work focuses on the discovery of immune and metabolic biomarkers of kidney transplant rejection. So, Amy, please join us.
Hi, everyone. So I believe Ruth and Len are the first speakers, so we can jump right into their presentation.
Thank you so much, Amy. Indeed, why don't we just go right to the next session? And if I may, Len, I'll take the liberty to start. Knowing your generous nature and having had the pleasure of knowing you for the past couple of years, certainly, I know how generous you have been with your time and contributions. You have participated in quite a number of research projects. So would you share with us some of those and the role that you've played in them?
Sure. Yeah, thanks for the kind introduction. So, I haven't actually participated in any transplant-related studies, and I'm still waiting for the opportunity to do that one day soon. But having said that, I do love getting involved in research studies, and I volunteer at Toronto General, and if you know the area, the walls around the elevators are covered with posters asking for participants for studies. And for whatever reason, I seem to offer myself up as a guinea pig to all of those on a regular basis. I think I've done 10 or 12 of them by now, maybe more. I'm not sure. My wife just keeps asking, so what are you going to have them do to you today? But anyway, it's a lot of fun. And it's really interesting research. And so, I feel that if I can contribute, why not? It's going to be good for everybody. Some of the studies that I've done have been really interesting. I've had my brain zapped by transcranial magnetic stimulation several times, low intensity focused ultrasound once. That was for studies of dystonia and other diseases. I've had a probe stuck into a nerve in my leg for a heart study. I've done balance and gait tests and brain scans for Parkinson's. I've had my memory recall or lack of memory recall tested several times. I love it. It's a chance to talk with a researcher, learn a little bit more about what they're doing. So yeah, it's a lot of fun. My involvement at this stage of the game has really been solely as a research participant, not involved in the study beyond that.
Thanks, Len. So indeed, as you allude to, it sounds like you're helping us make a distinction between a couple of important concepts. So I'll start by saying thank you for your participation in research. Research is impossible without such voluntary activity. But this also brings about an opportunity to highlight efforts that have taken place over the past couple of decades. With increased interest in patient-oriented research, there's also been a growing recognition as to the importance of engaging patients in research, not just as participants, but actually as partners. And I would say, intermittently, I will use the term patient participation, and again, acknowledging the overall scope and variety of participants in this forum, patients, family members, and donors. So please forgive me, I'll use the term patients probably more frequently, but clearly this should be a much more comprehensive recognition. So the understanding of the value added of incorporating the patient's voice in research process basically highlight the distinction. So patient participation is an act, again, a voluntary act of participation, but primarily as research subjects. There, the patients are being recruited to participate in a research project, the questions of which the process have been preconceived by the research team. In contrast, the patient partnership principle is also a voluntary role, but focuses on meaningful engagement, whereby patients become active members of the research team, sharing both from their lived experience, but also potentially non-health experience-related expertise. In this way, they contribute to the initiation, execution, as well as knowledge dissemination and implementation of knowledge as part of the overall research process. So maybe if I come back to you, Len, with this regard, as you reflect on the research contributions that you've had to date, you were alluding to the fact that you were playing a participant role. But if you were to reflect on potential engagement activities that you could potentially partner on, please share your thoughts with this regard.
Yeah, obviously, it's a much more, I think, interesting involvement or being involved in deeper into the study and the design of the study and so on would be a lot more interesting than just simply being a patient or a test subject. And it got me to wondering about whether those researchers whose studies I participated in, whether they actually had patient involvement in the design of their study. And so, having participated, it made me think about, should I try, contacting them and saying, asking them the question, did any patients have actual input into the design of the study in your case? And so I sent it to about 6 of the researchers that I was able to get a hold of. 3 of them replied back. And so this is what I heard back from them. So the first one said, for my study, I will go with a no. But the discussion I had with them during my study was useful to design to the design of future ones. So that's a no. Second one, the short answer is no. Patients in that particular study and most of our studies are not involved formally or directly in the actual design of the study, although there now is a stronger push from granting agencies to include patient partners in the process, which is kind of interesting. However, we will always ask patients informally during these visits if they have any thoughts, issues with the testing procedures, suggestions for improvements, et cetera, that we always then factor into subsequent study designs. And the third one was for the fMRI study, specifically, we did not involve patients' input into the study design, so that's another no. However, we do have other studies in which we do actively seek participants' involvement in the study design and process. We identify these individuals as patient research partners. So that's the feedback.
We basically summarize this experience with regards to patient partnership, to date, not really, at least on actual research projects that you participated in. Certainly your contribution to CDTRP also go above and beyond.
Yeah, it's unfortunate, isn't it, that they're not, this isn't something that's more ingrained, having patients, involved, patient partners involved in the design of the study. So hopefully that's something that we can talk about today.
Very good. So again, to be fair, on the patient partner or patient participation side, we need to emphasize how valuable this contribution is to begin with. We cannot generate knowledge without such participation. But again, today our focus is to move beyond this and focus on research partnership and engagement. So as we reflect on how this may be done, we thought it would be important to share the overall research process. And with this, I'm going to share a couple of slides just for us to go through together. So this was taken from a manuscript that was published by a team I was working with, the Training and Mentorship Committee of ChemSolve CKD, a publication that focused on inclusive methods for developing patient-oriented research tools. So we took from this slide one of the visuals that you could find in the publication on the research process. And so the research process, I would divide it very simplistically to about 3 stages: a stage of planning, a stage of execution, and then knowledge dissemination, implementation, and evaluation. So very briefly, we start by identifying and prioritizing research questions, designing a study, pursuing funding to actually be able to execute the study. And then once that is secured, there's activities of preparation to allow us to administer the actual research process. Thereafter, the execution of the research involves some data or biospecimen collection, analysis, and finally, subsequent to analysis, there's interpretation and then sharing of the knowledge with the scientific, clinical community, the public at large, and pertinent stakeholders, again, for our domain, patients, family, donors, as well as decision makers and payers, to facilitate, hopefully, translation of the knowledge acquired into actual steps that we could put towards improving patient care and experience. So I'll stop sharing the slides at this point, and we'll proceed with the next steps. Okay. So as we proceed with this discussion, I want you to reflect, Glenn, as our expert partner, how would you think that you could bring forth beyond your lived experience, which is exceedingly valuable to this process, certainly some of your other skills that may be acquired through education, work, hobbies that you might have to the research project, to the research process. Because in fact, each of these might have value added to each of the steps of the research process.
Yeah, I haven't had much of an opportunity to use my lived experience, so to say, or my skills, to contribute to these research studies. It's mostly been just letting them zap or poke or prod. But I could talk hypothetically, and I mean, we all have talents and skills that in of some sort. And just the fact that a patient partner is willing to give of their time to contribute to any capacity would be beneficial. So I look at that framework, and there's countless opportunities for a PFD partner like myself to get involved. And so, for lack of a better place to start, I'm just going to sort of think about hard skills. I'm no pro, but I love analyzing results. I love looking at for hidden information in test results. I'm not so half bad at Excel and maybe SPSS for data analysis. And all of those skills could potentially be useful. Even if it's just doing the grunt work of grinding through pages of data. I happen to be a software developer. I've written software for about 50 years. And that type of skill could potentially be used to mentor or to directly help a researcher create an app for a data analysis, let's say, or data collection, or to create a device to capture data points, for example. Now, in all fairness, I'm 60-ish years old. And chances are there's a real good chance that those researchers could mentor me, but we'll just let that go.
So as always, you underestimate yourself. I already see potential for recruitment here.
There we go. Okay, all right. I'm going to be hooked, aren't I? Obviously the obvious ones: Office, Excel, PowerPoint. The ability to do a presentation, to present data in a meaningful way. That's all important. But you know what? If I look beyond the skills, I think every life experience adds something to a person's skill set. So you start off by saying how your skills from education, work, and hobbies can contribute. But I'll add volunteering to that list. So I mentioned I volunteer at Toronto General, and so how could that add value to a research project? And I thought about it, and my first take on it was that there's really nothing there that's meaningful. But as you think it through, and you realize that I've been exposed to just about every inpatient and outpatient unit in Toronto General over the last 3 or 4 years. I've talked to nurses and doctors and managers and PSWs and cleaners and so many patients, hundreds of patients, and I've heard so many stories. And that's the kind of a soft skill that potentially has huge value, I think. And that exposure and experience can help with any aspect of a research project, even if it's just being involved in conducting interviews with patients to collect data and feedback, or my lived experience as a volunteer, as a patient, as a business owner, whatever, could potentially add to the richness of the interview and to the research project in general. And so I think a researcher might sometimes, have blinders on. They're so laser focused on their specific research and the outcomes that maybe they could miss some of the bigger picture, And so I think involving a patient partner who has more exposure or a broader range of experiences anywhere throughout a research project's life cycle I think it has the potential to be so far-reaching. And so my point is, never underestimate the potential contribution of a PFD partner.
I couldn't agree with you more, Len. And with your permission, I'll share a little bit of, I would say, my perspective as a researcher. So over the years, I've had the benefit of patient partners critically commenting on my research questions, study rationale, consideration with regards to patient recruitment, materials that we would share potentially with patients, instruments for either recruitment or data collection. This perspective is of significant importance in improving the process. So again, I could not agree with you more as to the importance of such engagement in increasing the value of the research, I would say, product that we generate, that it could in fact help improve upon care outcomes and experiences, as we hope to do as clinicians and researchers. So for those attending the forum today, we hope that this introductory session that Len and I have shared with you helps showcase the motivation for some of the discussions that will take place today and tomorrow. So throughout the forum, we will be looking into ways to promote a potential culture shift towards active participation of stakeholders in both experimental, observational, and importantly, interventional clinical research or clinical trials. So on behalf of Len and myself, thank you all for your attention and wishing you all a wonderful forum. Thank you so much.
Thank you.
You are the Canadian Donation and Transplantation Research Program. You are CDTRP.
The CDTRP is a network of more than 400 clinicians, senior, mid, and early career researchers, trainees, patient, family, and donor partners, and 100 partner organizations. Our network has supported 275 collaborative research projects and has mobilized research into policy change, legislation, commercial products, and improved knowledge for patients, families, and donors. Every year, CDTRP supports between $30 to $40 million in grant applications, something around 60 to 70 individual applications. You are CDTRP. These achievements wouldn't be possible without your hard work.
CDTRP Research Services is a platform that supports principal investigators to develop high-quality research in donation and transplantation. We work hand in hand with CDTRP investigators to maximize the effectiveness of research teams through support with funding development, project management, patient, family, and donor partnership, knowledge mobilization, events, and trainee support. Across the 5 research themes, we help teams mobilize new knowledge to ensure patient, family, donors, healthcare systems, partners, and stakeholders equitably benefit from research results.
If you are a basic scientist and would like support with your knowledge mobilization plan, if you are a busy clinician scientist with limited time for research but would like to run a multi-site study, if you are an early career researcher and looking for collaborators to help with your grant applications, if you value patient, family, and donor engagement but are not sure how to find the right patient partners or what role they will have in your project, if you don't have full-time research staff but need support,
we are here to help. Our experienced management team can support you at every stage of your research in donation and transplantation.
Now you are probably thinking, how can I request CDTRP Research Services support? The answer is simple. Go to the CDTRP Research Services Platform website, fill out the form to request support, and we will get in touch with you to discuss your needs. That's it.
We.
Nous.
Noi.
Nos.
Emis.
Nosotros.
Menk.
Kia no. We. Kia no.
Our CDTRP, and we will drive research advances so that every wish to donate is fulfilled and transplantation becomes a lasting and sustainable cure.
You are CDTRP.
Email us today.